to the Eastern Cape, where the Premier, Oscar Mabuyane, is ramping up the province's community-based COVID-19 response. 18 state-owned facilities are being turned into quarantine sites as infections increase rapidly. Hospitals are filling up, threatening to collapse the healthcare system.
Well, the province has over 38,000 positive infections, and eNCA senior reporter Aviwe Mtila joins me now from Bisho, of course, for more. Good to have you back, colleague. Now, what did the Premier then have to say about a story that you broke on COVID test samples found on the highway?
Well, Tumelo, the Premier welcomed the developments around that story. You'd understand that last week, Thursday, the National Health Laboratory Service basically released a media statement saying that it had fired the courier company that was tasked with delivering those test kits. Essentially, the reason behind those test kits being on the N2 highway, that's Gibela Trade and Investment Couriers, that has been fired. But the Premier also saying that more needs to be done in terms of strengthening. The National Health Laboratory Services needs to strengthen its capacity, basically, of ensuring that all those test kits arrive safely from the various hospitals to the designated laboratories. Another story that the Premier actually touched on were the allegations in the OR Tambo region, basically, of a door-to-door campaign that cost 4.8 million rands. So he, of course, condemned those allegations, saying that they were expecting it, knowing that people would be out there trying to take chances during this difficult time. But let's listen in on what the Premier had to say on those N2 highway test kits.
We also wanted to welcome the developments on the issue of the test kits that were in the care of National Health Laboratory Service, which were found on the N2 between East London and King Williamstown. That was an uncalled for incident which should have not happened. We continue condemning it. We've condemned it. The National Health Laboratory Services has done the right thing by terminating the contract of that courier company that was involved in the incident. They have to go back to the drawing board to fix their operational discipline. It is also a hard lesson to learn for other businesses as well to always do their jobs professionally.
So, Aviwe, the Eastern Cape being one of the provinces of concern, along with Gauteng and the Western Cape, and we're talking here in part about the situation with hospital bed availability. What has the Premier been saying about the availability of beds in hospitals in that province?
Well, Bratulas, the Premier and the Department of Health in the province will tell you that they have enough, sufficient beds at their hospitals. In fact, today the Premier was announcing an initiative that will earmark 18 state-owned facilities such as schools and museums, and those will be turned into field hospitals that would at least cater for 2,000 beds and 218 high care beds. But in speaking to the Superintendent General of the Eastern Cape, Department of Health in the Eastern Cape, Dr. Mbengasha, he did in fact say that there are sufficient beds in the province to cater for all patients, not just only COVID-19 patients. But let's listen in on that.
We had developed these 3,000 beds, but when we add and overlay oxygen onto those, we are now having a higher level of capacities of managing severe and critically ill patients. Our sense where we're sitting, we think that in terms of our progression and our planning, we have created and we are creating more beds as the problem gets worse. We got what is called a stress test in Dora, and we actually understood how do you really manage the portfolio of services that you have, and how you make sure that those beds are optimized and used at the right time at all the time. So we are really ready for the COVID.
All right, that was our senior reporter, Aviwe Mtila. Thank you so much for that update. Quite interesting there, of course, to hear from Oscar Mabuyane, just talking about, what they're doing for community development. But I know that while we were, listening to the superintendent about the beds, it seems the message from me is still not clear as to what exactly they are doing for these beds. I see a lot of tiptoeing around, the solutions around what has been done already.
So you get these reports weekly from government, from provincial governments telling you how many beds they've created, how many bed spaces are there. Sometimes they're not really consistent, as you saw there. Aviwe pressing the provincial official there, Dr. Mbengashe, about the situation at Cecilia Makiwane. It took at least 3 questions from Aviwe for us to get an answer on that situation. So I just think that perhaps government could think about giving us a kind of overview. Open it up. Let us know what is the exact situation on a day-to-day basis for us to be on board.
And I think they should also emulate what the Ministry of Education did within the province when he said we are not ready to accept some of the learners back into school. If there are no beds in hospitals or in any quarantine facilities, honesty, I think, is one of the few steps that will actually assist in saying we're still working on this community. Nothing has been done yet, but it's still a work in progress. But indeed, hopefully the province will find that resolution.